in the spirit of what we say here at the Functional Forum, we got to stop acting like we're losing and start acting like we're winning. And the one doctor that's doing that more than anyone, Dr. Mark Hyman.
Hey everybody. You guys are brave to practice all day and come out at night and listen to talks. That's pretty good. So we're at a transition point, a serious transition point. I've been doing this for over 2 decades, and I see many of you in the audience I recognize have been doing this for a long time. And I want to share with you a vision of what the future might look like, because we're at the precipice of that. And we don't have to be apologetic anymore for what we're doing, because we're doing the type of medicine that will be the future of healthcare. A couple of years ago at Davos, I met Toby Cosgrove, who invited me for dinner with a group of people that included the head of IDEO, the CTO of Microsoft, some really extraordinary people. And I wasn't sure why he asked me for dinner, because I'm a doctor, I'm not exactly at that level. So I began to realize what he was doing. He was wanting to explore bringing functional medicine into Cleveland Clinic. And for 2 years he's been chasing me to try to get me to come to Cleveland. Now, there's no way I'm moving to Cleveland. But we've been in conversation. I said, okay, what do you want? And they really got that he was interested in looking at innovation that was going to change the way we practice and deliver healthcare. And that he saw what was happening in the field of functional medicine and the things that we were doing and realized that that's where the future was. And I said, Toby, you don't want me there. Because if I go there, I'm going to be very disruptive. I'm going to tell you that most of what you're doing is wrong, that in fact you're harming people, that I would want to implement programs that are going to empty out half your hospitals and clear out most of your procedure rooms, and that are going to reduce hospital visits and hospital stays and doctor's visits dramatically. Are you okay with that? I said, what if I told you we could cut your angioplasties and bypasses in half? Would you be okay with that? Because that's where you guys make your money. He goes, I know, you're right, but medicine's going in a different direction. And I think they're motivated in part by doing the right thing, and they're also motivated in part by looking ahead and seeing what's happening with how reimbursement's going to shift to be accountable for outcomes instead of volume. So the amazing story is that despite my tremendous resistance and my continual efforts to convince him why it was a really bad idea to have me there, we are going to start a functional medicine institute at the Cleveland Clinic in September. And my criteria for doing it was to do it right. So we're going to put millions and millions of dollars behind this of the Cleveland Clinic's money, which has never been done before to help this field. We're going to create a clinical program where we want to bring in best practices from around the world. We want to create innovation summits where we bring in some of the top thinkers, including some of you in this room, for summits where we download what are the best practices for the conditions that we treat. What is the best thinking out there? What is the best treatments available, the best diagnostics? How do we begin to create practice guidelines and clinical programs that are scalable and can be taught around the country? And then how do we build an educational curriculum for undergraduate, graduate, and postgraduate education? IFM is for postgraduate education, but we want to get all the way down through. They just started a medical school there, and they're partnering with Case Western, and they are very interested in innovating in education. And we're going to create a clinical research program where we're going to test this model and go head-to-head with conventional care and show them for autoimmune disease, for diabetes, for migraines, for asthma, for the whole list of issues that we treat people for successfully. We want to show that this works better than conventional care. So you're going to hear more about this over time, and those of you who come to the Functional Medicine Conference in San Francisco, who's going there in the it's going to be fantastic. It's sold out. For those of you who want to go, I'm sorry, there's no more tickets. I can't even get barely a ticket. It's actually quite amazing. Each year we hold these conferences, we expand what we're doing. So we went from 400 to 600 to 800 to 1,000 to 1,200. Now we're at 1,500, and we keep getting bigger venues, and they keep selling out months in advance. You think it's like a playoff game or something in the NBA. You can't get a seat, and people are emailing me and begging me to help them, and I don't have any pull. So it's really astounding to me to see the interest that's happening and the change that's happening in medicine right now. And to have somebody like Cleveland Clinic who is really one of the leaders in healthcare, who's looked to as an institution that is really at the forefront of change, and to have them come to us for help, that's a statement of where we're at. So I don't think we need to be apologetic anymore. We don't need to apologize for what we're doing or be on the outskirts. We are at the center of the change that's happening. You're all at the center of the change that's happening. So I'd like to share with you a little bit about how I believe we can really create transformation in health. And my thinking has changed over the last few decades. This movie speaks to a really important problem. And I encourage you, for those of you in New York, it's starting Friday at the Angelica Theater in New York City. It's the only place it's showing, so I encourage you all to go, bring 10 people, go on the weekend, and watch this movie, because it really is a tipping point in our thinking about naming the problem, which is the food industry and how they've created products that promote disease. The diseases that we're all treating in our clinics. So it's like we're standing at the bottom of a waterfall trying to mop up the floor while the waterfall keeps gushing at us and pouring disease-producing products into the marketplace that are affecting our patients. And the thing that needs to happen is not just changing the way we practice, and that's important, but it is changing the whole upstream cause of this problem. You know, I was at the World Economic Forum in Davos, and I gave a couple of talks, and I was at this initial meeting, and there was all the powerful players in healthcare in the room. There was a few hundred people, and they had a panel of the head of Sanofi, and the head of Aetna, and the head of this, and the head of that, and some guy from Harvard School of Public Health was moderating, and it was, you know, a very impressive panel. And they were talking about how do we deal with the crisis in healthcare. And they talked about how we improve efficiencies in healthcare delivery, how we reduce medical errors, how we improve health IT, how we coordinate care better, how we deal with care management and chronic disease management. And it was, you know, this discussion of what I felt was like moving the deck chairs around the Titanic. And afterward, and all those changes are necessary, but they're not sufficient to create the change we need. And I got up at the end, and I said something which I thought was completely obvious. I said, you know, all these things you're saying are great and need to be done, but have you ever thought about what we need to do to prevent the fact that there's going to be $47 trillion spent on treating chronic disease over the next 20 years globally? $47 trillion. That's more money than the GDP of the 6 largest countries combined, right? It's an enormous, I don't even know what a trillion, I can't even write a trillion. I don't know how many zeros that is. That's why I'm a doctor, not doing anything else. I can't do math. So the question I said was, how do we prevent those patients from going into the system in the first place? How do we deal with the cause of the problem upstream and not get the people in the system? And they were like dumbfounded, like it was the most brilliant question that had ever been asked at the World Economic Forum. And afterwards, the head guy who was running the panel came up and said, "Mark, that was such a great question. And we hadn't thought of that." and we all discussed it in our closed meetings and how great an idea that was. And I'm like, you're kidding me. You guys are running the ship here. So that's what we need to do. And I've been doing functional medicine for a few decades, and I got into it because I was sick. I had chronic fatigue syndrome. I had mercury poisoning, living in China, breathing the air, and I have all sorts of issues that happened. And I developed, I was riding my bike 100 miles a day, and fit as I'd ever been. And I went from functioning at a level where I could see 30 patients, remember every person, not take a note, and dictate their chart at the end of the day without any notes, to not being able to walk up the stairs, to not being able to remember where I was at the end of the sentence where I started. I couldn't read my stories to my kids out loud and actually understand it at the same time. I could read out loud, but I couldn't actually understand what I was saying. That's how bad my brain was. It was like I had ADD, depression, and dementia all at once. And I had abnormal autoimmune antibodies. I had elevated CPK levels of 600. I had abnormal liver function tests. I had low white count. I had all these bizarre things. My gut wasn't working. I had rashes, sores on my tongue when I eat foods. I just was a mess. And I had to sort of struggle to figure out what was going on. And I was working Kenya Ranch at the time, and one of the nutritionists said, Mark, you should go meet this guy, Jeffrey Bland. I'm like, okay, fine. So we went to this conference, like 1996, I think. And I heard him speak, and I said, either this guy's a genius or a lunatic. And if he's right, then I owe it to myself and my patients to figure it out. So I began to try it on myself, like many of you probably have, and I started trying my patients, and they would get better. And I would say, eat this, take this, do this, and call me in 3 weeks. And they would call me back and say, my migraines are gone. I'm like, they are? They say, my autoimmune disease is gone. I said, it is? And I didn't believe it because it was so out of the realm of what I'd learned to actually be true or effective. So I spent, the last 20 years, working intensively to refine my understanding of functional medicine and to help push the field forward through the institute or the textbook and with our certification program, and build the infrastructure and the model of the matrix, which is understanding the body as a set as an ecosystem, as a system, and that it's a system comprised of intersecting biological networks. We call them matrix, that are influenced by our genes and the environment, that create imbalance in these components in these nodes in our network, and that what we do as clinicians really needs to be understanding these dynamic systems and how to play with them, how to work with them, how to remove the things that are causing impediments to the optimal functioning of these systems, and to add in the things that are going to help our organism thrive. And it really comes down to a very simple process, which is understanding the biological networks in the matrix and removing the things that cause impediments, which are toxins, allergens, microbes, stress, and poor diet, and adding in the things that create thriving, which are the real food and nutrients and right balance of hormones, air, water, light, movement, rest, rhythm, connection, community, love, meaning, and purpose. Those are all the ingredients for creating a healthy human. And so in my practice every day, that's what we do. And we see, extraordinary results. And there's still pockets where we're stuck, where I think, Lyme disease is one of them. And there's some others that are challenging for us. But I think for the most part, we do way better for most of the chronic conditions that we're suffering from in this society than anything else out there. But I recognize that wasn't sufficient, and that that people were living in environments that were promoting disease. So I went. I want to talk about this model, which I call the 4C model of health transformation, because we can't just practice medicine. We have to think health is bigger than that. Health doesn't happen in the doctor's office. Health happens in our kitchens. Health happens where we live. It happens where we work, where we learn, where we pray, where we play. That's where health happens. It doesn't happen in the doctor's office. There's 5,786 hours in a year, and if you don't believe me, you can count them. And how many of those do you spend in the doctor's office? Maybe a few. And what happens to the other 5,700 and some odd hours? It's where you're living. And so I realize we need to expand our definition of what we need to do to create health. And I think as physicians, we think kind of narrowly as just our practices, but we need to really begin to think of ourselves as healthcare providers in a broader sense. So the first C of this 4C model is the content of care. What is it? What is the intel inside? What is the DNA? What is driving the biggest change in biology? Right? How do we drive the biggest change to create health? What is the science of creating health? And I believe that's functional medicine. And it's evolving, it's changing, it's improving, and we're going to continue to refine the model. And that's why I'm excited to partner with the Cleveland Clinic, because it gives us a way to leverage and accelerate that process. So that's the first C. The second C is connections. And the connections I'm talking about are the connections between human beings that create change. So I began to think about this when I went to Haiti after the earthquake. And like many of you, I watched on TV and I saw what happened, and I was sort of dumbfounded and felt helpless and had the urge to go. But I had no way to go, so I didn't know what to do. But I realized I wanted to go. And unlike many of you, many of my patients are billionaires. And one of them emailed me with a subject line, want to go to Haiti, and he had his own Gulfstream 5. So he said, get a team together. So we got a team, we loaded the plane up with gear, and we went to Haiti. And we were the first people on the ground. I brought Paul Farmer with us, and we were in the trenches. And then I got to know Paul Farmer, who, for those of you who don't know him, he's modern-day Albert Schweitzer. He's really an extraordinary guy. Partners in Health is an organization that's changed the face of TB and AIDS in developing countries and how we treat them, and as a model for the Clinton Foundation and the Gates Foundation. And what he discovered was something very simple. He said the solution to TB and AIDS is not better medication or better surgery or better medical care. The solution to TB and AIDS is each other, is this simple notion of accompaniment, that we have to accompany each other to health. So he created community health workers, peers, people helping people, going to each other's homes, making sure they had clean water, food to eat, that they had their medication to take at the right time. And he proved that that worked better than anything else. And then I began to think, wait a minute, this doesn't work just for infectious disease, it works for chronic disease. In fact, chronic disease is also contagious. That you're more likely to be overweight if your friend's friend is overweight than if your parents are overweight. Even if your friend's friend is overweight who you've never met, you're more likely to be overweight. That our social connections and our social threads are more important than the genetic threads that connect us to our medical fate. And I recognize that if disease was contagious, that maybe also health was contagious. And so one day, as I'm sort of chewing on this, and I read a book called Turning the World Upside Down about the way in which the first world could learn from the developing world about how to solve our healthcare problems by the use of communities. And he said, Nigel Crisp, who's the the head of the National Health Service in the United Kingdom, said, we need to turn healthcare upside down and put patients and communities at the center of healthcare, not doctors and hospitals. And so I began thinking about this, and I didn't know what to do. And then one day this guy walks in my office, this really overweight guy who was Rick Warren, who was a pastor from a church in Southern California, who gave one of the invocations at Obama's first inauguration. And I'd heard of him. He wrote The Purpose-Driven Life, which sold more books than anything other than the Bible, nonfiction. And so I took care of him, and he wanted to lose weight. And I said, hey, why don't we go for dinner after? So we went for dinner. I said, so tell me what you do. Because, I'm a Jewish doctor from New York. I don't know much about Christian churches in Southern California. So I said, what do you do? So we got 30,000 people. I'm like, wow. He goes, yeah, we meet every week in 5,000 small groups. And I thought, well, this isn't a mega church. These are thousands of mini churches. And the light bulb went on my head. Said, Rick, why don't we create a healthy living program for the church and see what happens? He goes, great, because I was baptizing my church the other week, and after about the 800th person, I'm like, man, we're a fat church. And I'm a fat guy, and I just looked at 160,000 pounds. So we created this program based on this idea that people helping each other could change our behavior, that the connections that we have with each other are the very thing that's going to change how we live, how we eat, how we exercise, our stress levels, all the things that really matter when it comes to changing our health. And we thought a few hundred people would sign up. The first week, 15,000 people signed up after our first rally. They lost 250,000 pounds in the first year. And this has continued today. In fact, on Sunday, I'm going to Atlanta to meet with all the black pastors in Atlanta to bring this into the churches in the South. And we wrote a book called The Daniel Plan, which came out last fall. It was #1 New York Times bestseller, and I wanted to call it The Jewish Doctor's Guide for Christian Wellness. But I couldn't really get that on the cover as a subtitle, but it's quite extraordinary. And you've got a Jewish doctor, a Muslim doctor, and a Christian doctor working with a pastor doing cooking classes on the podium or the whatever you call it on stage, and it was phenomenal. I got up and, when we had this big rally to launch the book, I said, if Jesus came to dinner, what would you feed him? I said, would you feed him a Big Mac, fries, and a Coke? I said, if you believe God lives in you, why are you feeding him crap? And I said, it's really simple. I said, the message is really simple. Leave the food that man made and eat the food that God made. So, I wrote this book. We wrote a cookbook and a curriculum and a program for churches and campaign for the pastors. So we've kind of made it goof-proof, step by step, for the churches to scale this and for synagogues and for whoever wants to do this. So I think, it made me realize that the power of social networks is really the power of change. I did a program for my 10-day detox diet, and it's really dealing with the biology of sugar addiction. And we had a group of 600 people do it, and we created a private Facebook page online. Am I talking too long? No. Okay, because James? Okay, good. I got a couple more minutes, and I'm not talking too long. I figured. I know. I got it. I'm on my way there. I'm sort of meandering to the C's. So we're on the second C. We're good. Wait, where was I now? Okay, so we did this online Facebook page, and we had 600 people do this program, and they lost 4,000 pounds in 10 days and 2 inches off their waist, and their blood sugar dropped 20 points, and their blood pressure 10 points, and their MSQ, the medical symptom score, dropped an average of 62% in 10 days, which is phenomenal. That's an average of 600 people. But what struck me was that we had this Facebook page, and in 10 days, there were 1,500 pages of Facebook interactions and comments and connections. That people were desperate for connection. They were desperate to support and help each other, encourage each other. And I wasn't even doing it. I wasn't even in the picture. In the church, we had 3 doctors providing our content, but we weren't running these groups. We just provided some of the content. So I realized that the power of each other and the power of social connections and the power of social networks is really the key to changing our behavior. So to change biology, you need the first C, which is functional medicine and power to change biological networks. And to change behavior, you need the second C, which is connections, or the power of social networks. The third C that I see is really the change that we need is community. And what I mean by community is the environment in which we live. And unless we change the environment that we live in, it's hard to change. In this movie, Fed Up, there's a family that I went down to see, and they were very overweight and very sick. The father was 42 on dialysis, renal failure from diabetes. The mother was massively overweight. The 16-year-old son was massively overweight, pre-diabetic, 60% body fat. He wanted to know, he said, could I get to 100% body fat? I said, no, you can't, but don't worry. And we looked at all their blood work. I went with them, and I said, they lived in Easley, South Carolina, which has a restaurant. It's called a Retail Environment Food Index. There's something called the Retail Environment Food Index, which is how many fast food and convenience stores there are to produce markets or grocery stores. And there it's one of the worst ratios in the country, 10 to 1. They live in a food desert. And they lived on disability and food stamps. And I said, I don't need to give you a drug or tell you what to take, but let me go to your house with you. Let's cook together. Let's make a meal together. Let me show you how to cook a simple meal. So I'm on the environmental working board group. I'm on the board of the environmental working group called, we created a guide called Good Food on a Tight Budget. It's been a long day. I've been on CNN and this and that. So, oh yeah, I'm on CNN right now. Jesus. It's my stunt double. Actually, I am. It's on right now. So can you just play it so I don't have to talk anymore now? So anyway, I went to their trailer and I said, let's cook a meal. And I gave them my cookbook, a blood sugar solution cookbook. I gave them this Good Food on a Tight Budget, which is how to eat food that's good for you, good for the planet, and good for your wallet. And I cooked with them. They didn't have knives and cutting boards. We had to cut sweet potatoes with a butter knife on a plate. And they didn't know how to peel garlic. They didn't know how to cook a vegetable. Nothing. Like they had, and I showed them what they were doing. They had no idea. And I showed them how to cook a meal, and they did it. And the mother's lost 100 pounds. The father lost 45 pounds. Was able to get a new kidney because he needed to lose 40 to get a new kidney. The son lost 40, but then he went to work at Bojangles because the only place to get jobs there is in the fast food industry. So he was in a toxic food environment, and he gained the weight back. And it's sad, and we're going to help him, but it just sort of exemplifies the issue of the environment that you live in and how it determines your behavior. If you're in a food desert, or you're in an area where your friends are all doing things that are harmful to them, or where you're in a work environment where there's candy in every drawer, where you're in schools where 50% of the schools in this country have fast food in the schools, Pizza Hut, Domino's, Burger King, McDonald's, literally serve their products in the schools by brand name. How can you be healthy if the environment you live in is toxic? And Dan Buettner wrote a book called The Blue Zones, and he's created an initiative around creating healthy communities. So he went into a little town in Albert Lea, Minnesota, and he said, let's not tell people what to eat or exercise or anything. Let's just create an environment where it's easy to do the right thing. So let's change what's at the checkout counters at grocery stores. Let's give people 10-inch plates instead of 12-inch plates. Let's let kids not eat in the hallways or the classrooms, only in the cafeteria. Just by doing that, they had a 10% reduction in weight in these kids simply by changing the way their environment was structured. They built walking paths. They had grandmothers. They created an initiative where they had grandmothers walk the kids to the school bus. So they started walking more. And they just had simple interventions that dramatically reduced the healthcare costs in that community and improved the health of that community simply by changing the environment in the community. We did that at the Daniel Plan. The church changed what was in the refineries, changed the menus, changed the grocery stores, changed what they were providing in their grocery stores and how they were labeling the foods. The restaurants started changing what was in the menu. That's happening in places like New York where you can get gluten-free food and you can do all sorts of things, but it doesn't happen in most places. We need to change the community. And there's a lot of initiatives that are happening around that. The fourth C, and I'll let y'all go home. The fourth C is this idea of connectivity, which is how do we use technology to help make these things available to everybody, to make it easy to do the right thing, to get the support that you need. And there's a whole quantified self movement, which is ways to track your biology and get interactions. People are using the Fitbit or Jawbone, and they're comparing with each other. They're doing it in communities. They're doing it through social connections, and they're getting feedback. So we know people tracking their results makes a huge difference, and the digital platforms to do that are important. And there's going to be more and more of that. I'm working on an app right now with a company that is headed by this woman who was the former VP of Commerce for Google and people from Apple and Kaiser, and they're creating a very interesting app, which is a digital coach, a coach in your pocket, essentially, where they're creating an app where you can interact with live coaches. So if you're in the healthcare system and you're a doctor, you have someone who has rotator cuff injury, well, you send them to the physical therapist, right? But if you have someone who has a lifestyle injury like diabetes, where do you send them? There's nowhere to send them to. So you can refer them into a system where there's coaching and support and help to sort of fill that gap in healthcare. So it's sort of like use of technology to sort of bridge some of these gaps. And I think with really looking at health in the bigger space, the content, the connections, the community, and the connectivity, we can begin to see how we can shift the whole model of what's happening. And when I say even the community, I mean the policies. In Mexico, for example, they had a dramatic increase in diabetes and obesity as their soda consumption increased, which is now 20% of their calories. And it was crippling the country. And they looked around the world at what were the interventions that made a difference to change the health of their citizens. And they found there were a number of key things they found, and they implemented them. And even Michael Bloomberg, who I saw last night, helped them implement some of these issues. One is the soda tax. 2 was ending food marketing. 3 was getting rid of anything that wasn't helpful for kids in schools. And 4 was food labeling that made sense, as opposed to the labels we have now that even if you have a PhD in nutrition, you can't understand, right? Green, eat it. Yellow, caution. Red, eat at your own risk. Simple, right? Like now you have a pack of cigarettes that says, if you eat this, smoke this, it'll kill you. Your coach said, if you drink this, it'll kill you. And then right? So I think we need to begin to think in those broad strokes where we work at all these levels, the biology, the community, the connectivity, and the connections between people. And I think with those broader frames, we can begin to shift health of America. And we all have to do all these things in our life all the time. I work at all these levels because I think we each have to do it in whatever small way we can, whether it's in our schools, in our workplaces, in our offices. We can make these changes and begin to be models for the healthcare that has to happen in the future, which all of you are part of. So I hope you help me, and I hope we all just do this together, and we hope to take back our health together. Thank you very much.